I'd like to turn to the clinical side of non-small cell lung cancer. What tests help you identify the type and stage of lung cancer?
So we need, obviously you need a CAT scan. You need a CAT scan of the chest, abdomen, pelvis, and you need an MRI brain and a PET scan. Those are really the gold standards for determining clinical staging. In regards to pathologic staging, it's really important to have tissue sampling. So you biopsy a site of disease that's concerning to you. If it looks like there's only disease in the chest, you want to biopsy the site where there's the tumor. And then you talk with your thoracic surgery or pulmonary team to determine the best way to sample the mediastinum for full staging.
Why is an accurate diagnosis so important?
So an accurate diagnosis is so important because lung cancer is by no means black and white anymore. There are so many different histologic subtypes that we are learning about. There are so many different molecular drivers that we are learning about. So, making sure you have the right diagnosis, full next generation sequencing testing, all of the imaging that you need could really, make or break your treatment plan.
Dr. Preeshagul, let's talk about biomarker testing. How is biomarker testing for lung cancer different from hereditary genetic testing?
So we do hereditary genetic testing for lung cancer patients as well. So I think let's backtrack a little bit. When you're doing testing on a patient, there's germline mutations and there's somatic mutations. And germline mutations are mutations that you might get from mom and dad, that they got from their parents, and so on and so forth, that you could give to your children or your brother and sister or whatever. So that's germline testing that could be passed along. That would be like BRCA or any other APC gene. But we are learning more and more that there are mutations in lung cancer that do have a hereditary aspect to them. So we are learning now that while we do somatic testing, which is somatic mutation testing, which is to find a mutation that just spontaneously happened in your tumor all on its own, it's really important to pair that with germline testing to make sure that there isn't some kind of heritable mutation that's also driving this lung cancer.
You mentioned hereditary genetic testing. Should family members of people with lung cancer undergo genetic testing then, just to be reassured?
So if there is a germline mutation, then the family members should be referred to a geneticist to have that discussion.
What are common lung cancer biomarkers?
So we have 9 biomarkers with an approval right now, but there are so many. There's more than I could even talk about today. But I mean, some of the more common ones are EGFR, ALK, ROS1, MET exon 14, you have KRAS G12C, which is a newer one. We have NTRK, we have RET. I mean, the list goes on. HER2. I could talk for, there's not enough time on this Zoom video to talk about all of the mutations, but there's nine mutations with approvals as of now. To date, this very moment, that could change tomorrow.